Okay, we are back. Senate Health and Welfare, January 28th. And committee, we have some language that was forwarded to us from Sarah Clark, the Budget Adjustment Act language related to the specific fiscal requests. So this is available to us online. I'm just going to ask you to go through it when you have some time before next week. And we'll try to set a time. I don't know that we can do it Tuesday, but we'll try to set a time to look at this with Sarah Clark. And in the meantime, I know that the budget adjustment is being adjusted in appropriations. So we'll see if we can catch up with the work that they're doing, but please do look through this, and then we'll find the items that you are most passionate about so that we can communicate that with the chair of appropriations. And this won't be a written, I don't think this will be a written communication, but I will be in contact with her to talk with her about this. So just please do look through, and we've already talked about it a little bit. But that's all I was going to do with that today, since we don't have Sarah with us. And the one thing, Nolan is here, and Nolan, if you could communicate, or Aaron, you can communicate with Sarah and ask her specifically where the Medicaid reimbursement is located. We'll be looking for it as well, but that's something I think that we were talking about today, so we want to find that. And anything in here as you're going through on parent-child centers. So if there's anything here related to them, pick that up. That's it. Okay. Then for next week, we have, again, we're going to have a pretty big week. We're going to go back to S91 on Tuesday, and hopefully we'll have some time to listen to the parent-child centers and sort out any of the questions that we asked earlier today. And we'll work with Katie to do some markup on the bill and get it as complete as we can. I think that if we can get this bill out sometime pretty quickly next week, may not be Tuesday because we'll still have language that's being added or changed based on what we've heard from Miranda, the deputy commissioner. And then on Wednesday, we're going to be looking at the S206 and hearing from Alzheimer's folks and folks affected by Alzheimer's. And then we're going to move into, so that'll be strictly testimony and helping us understand if or what needs to change in that bill. And I'm thinking that bill is also one that we may be able to act on fairly quickly. Then we'll spend some more time talking about our mental health bills and looking at the language that's in 194, 195, and 197. I think we're all getting emails about those. And the good thing that we're getting is that people are very supportive of the work that's in each of those bills. And I'm hoping that we can work on them as well. Then we will continue a discussion on our committee bill on Thursday, and we've got some folks coming in to help inform us on that. And then we have a small bill. We have a bill, it's not a small bill, it's an important bill on prescription drugs. And on Friday, we're going to be looking at Senator Hardy's very favorite bill, and that is the S198, the Diaper Need Working Group bill. And we both like that one. So we'll have folks in on that. And then that's it right now for the week, but we'll be scheduling the bills that we looked at today. Then we'll follow up with what we've heard and get some folks in on those bills. So we're we'll have testimony that we need to keep us moving forward. My request is that you look at the mental health bills. Those are so critical. And then also read through the task force report on those sections that have been identified, that we may be thinking about putting something in. So, and we'll get folks in to help us with the moderate needs group and with the blueprint, so we fully understand what they are, and then what we may be able to do. So I think we've done a lot of work this week. You all have been very helpful, and I think we're going to take a break and give ourselves some time. I think this is a good opportunity to do some of the BAA analysis, or walk through or the task force information, if you give you that time. So anybody who does not wish to adjourn at this time? Okay. So